That's just a video that's on the NHS Choices website that's giving an introduction about coronary heart disease for someone that doesn't understand it. And you can start to see the power of video and sound and a real life actor trying to describe it and trying to explain what to do. And these are some of the things that, again, patients can be directed to and look at in their own time and understand it better. This was real life stories, and there's another video, I'm not going to play it now, but this is a 36-year-old mother with an 18-month-old child who had chest pains, didn't know what was wrong with her. Husband found her feeling very pasty, got to the hospital and she was actually having a heart attack. In fact, she had a subsequent heart attack later while she was in hospital, and describing her cardiac rehab and how wonderful things are 2 years down the line, and she's doing really, really well. And again, to my mind, that's a fantastic video showing that actually having a heart attack is not the tragedy, and actually we can turn it around into an opportunity, and she's smiling about how she's changed her lifestyle to improve things for her. I mentioned the Map of Medicine. The Map of Medicine is a knowledge management tool that's been designed for doctors and nurses primarily, but is also available for patients to see. I've been sharing this with my patients now for a good 2.5 years, and what I've found is, although it's got some technical language, patients with diabetes, mellitus, ethnic groups, crushing, gripping, tightening, chest pains, which might not mean anything to anybody else. If you're a patient who's a sufferer, who's experienced these sorts of chest pains, then those might be terms that you've heard of or understand. Or in fact, if you don't understand it, then what a great opportunity for you to be able to talk to the doctor or nurse the next time you go to find out what those terms mean. It's a pathway thing, so you can see chest pain, associated symptoms, history, examination and so on. It's there to help doctors and nurses, but it can also help you when you're looking at the history and think, well, could that be me, or is there something there I need to raise with the doctor? History examination, working diagnosis, these are the things that you should do when you call for an ambulance, administer aspirin, GTN. If it's a family member and you're not able to get to it and they're aware of these things, they might be able to, well, they can see if the ambulance is being asked to do this, well, that family member might be able to do it, especially if they know that you've got that red bottle in your bag and you don't quite know what it's about. And of course, in this situation, seconds count. And there, all you're doing is providing the very same information that's expected of me, that's expected of Dr. Puri and his junior doctors. Green is primary care. When the ambulance arrives and takes you to A&E, it changes to blue. And this is actually what's expected for the hospital doctors in the A&E department or on the coronary care unit. ECG on arrival, assess patient for chest pain, assess patient for associated symptoms, and these are the symptoms that the doctors in the A&E department are expecting. And again, you'll look at that and think, well, that's not rocket science, that actually makes some sense to me. It helps me to understand what's going to happen when a hospital patient arrives at the hospital. The point I'm making is that this is not voodoo. It might be able to help you to understand what's going on so that you can support the patient, the clinician who's trying to help you there.